Leanne Manus, they're the ones on the screen. Peter, if you can see those are to the minister. Perhaps you can jot down one or two notes. But I will ask one directly, which I think is an exceptionally important issue. This is from somebody who's writing at Leanne Manus on my Twitter account, saying, can't tell you the name, but it's the Twitter handle is Beesoorgies, if you want to call it that way. I'm a nurse with 15 years of experience. I worked overseas for 2 years. I'm at home now for a year, and I cannot get a job in a state hospital, and I live in Port Elizabeth. Now, there is a tragedy in itself when we sit as a country that are desperately in dire needs of nurses and doctors, and yet there is a nurse writing to us right now in Port Elizabeth, desperate for a job and cannot get one. What is going on? What is the problem when it comes to jobs in the health sector? Minister, this is over to you.
Leanne, thank you very much indeed. Minister, Leanne just got a question from someone who says that she's got 15 years experience as a nurse. She's just come back from overseas. She lives in Port Elizabeth, and she says that she cannot get a job in a state hospital. So sometimes the skills are there, but they're just not being employed. I got another tweet earlier on. Someone was saying that she's working alone in the ARV department and that her hospital is just not hiring people. So what is the problem? What is the disconnect there? That we've got the skills?
Yes, I've made a call, Peter, especially about nurses that are returning, who were working overseas, who were recruited by other countries. Because there's been a complaint about us not being able to retain our people. You know, nurses, doctors, pharmacists, all being recruited by overseas countries. I've made a call that if they experience problem, they must come here to the Department of Health, because we don't understand that. We did have a few complaining about not being employed. But we found that it is a problem within our country, within the nursing profession. And I raised that during the nursing summit last year, where some of the nurses themselves actually don't want them. And they say they've been away, they are coming back to take our jobs and senior positions and all that and all that. We're trying to solve that matter because we think it's a bad thing. But the other thing I want to mention, Peter, you are right. Sometimes as South Africans, we over-exaggerate this problem of skill shortages, simply because we are not focusing, we're doing wrong things. Take, for instance, the example of the forensic laboratory services in the country. They've got a huge backlog, but 2 weeks ago, we decided to solve this problem. We got 70 unemployed graduates in the field of chemistry, biochemistry, and chemical engineering. Some of them even have honors degrees, but are unemployed. And how does that happen in a country with skill shortage? So we took all 70 of them. They are at the University of Pretoria, being mentored in forensic toxicology for 7 months. For 5 months, they'll be doing experiential training in our 3 forensic laboratories. In April next year, we're going to hire all of them. And we're going on searching for unemployed graduates to do a similar thing. Look at MCC, the problem that arose about MCC. We are looking at an offer here. It's a pity that I'm talking about some of these things before they materialize. But we are looking at the possibility and an offer to work with the FDA, the Federal Drug Administration in the USA, that some of their retired scientists can come to South Africa. We look for, again, unemployed graduates in the same field, and they mentor them. And we deploy them into South African Health Product Regulatory Authority. We are looking into that. So we have already started with an example about these unemployed graduates in chemistry. And we'll keep on doing that. But if there's any nurse who has been trained overseas and doesn't have a job, please conduct that immediately.
All right. So you're saying, and you're giving an assurance that any nurse who's trained and qualified need not be unemployed in this country?
Of course.
Okay.
Because there's a shortage. How does that happen? You may remember that in January, I had to rush to the South African Defence Force to ask for 5 theatre nurses for Chris Hani Baragwanath Hospital.
So you're going to intervene at these hospitals that are not hiring to tell them to hire these people?
Absolutely.
Okay, so they must contact the National Health Department.
Yes,
I hope
definitely.
that answers it. Okay,
Definitely.
All right, there you go. All right, let's go to table number 27. Avinash, if you could, yeah. And say your name, please.
Honorable Minister, Avinash Kalkabasadia from JP Morgan. I'm an equity analyst covering the hospital and pharmaceutical spaces. My question just surrounds the private healthcare industry. How does it fit into your overall plan for the NHI? Are we moving towards a public-private partnership system? Are you going to utilize the private sector going forward? Thanks.
Okay.
The actual principle of NHI is to use the healthcare that exists within the country. I am on record as saying we had a fragmented health system in this country during the apartheid era, fragmented in terms of color. That was abolished by the Constitution of the Republic of South Africa in 1996. And we thought we'll have one healthcare system. We woke up to find 18 years after democracy that we still have two healthcare systems, one depending on the depth of your pocket, and the other depending on how shallow your pocket is. That's another form of discrimination. In NHI, we want to use most. There is a temptation for people that whenever we talk about NHI, they believe it's a competition between public and private. That should not be. That's not how NHI systems are run all over the world. The aim is to find how do we utilize all of them, but using the preconditions I've mentioned, by the way, that the public health system must also work, and the pricing in the private healthcare industry must be regulated. Then we'll be able to utilize all of them. And lastly, Peter, people are asking us questions. I've actually told you that we are being held by the UK in most of our endeavors. One of the CEO of the National Health System, a former CEO, who is now in the House of Lords, Lord Nigel Crisp, he asked me a question. He said, what are you guys trying to do in your country? Everybody who earns some form of salary when they are sick, they believe they must only be taken care of in the private healthcare sector. He said, here in Britain, the rich, the famous, and the mighty still find a way to use the public healthcare system. And I'm saying we need to do the same thing in the country, because the private healthcare system can't care everybody. 80% of the population still depends on the public healthcare system. As an example, there are 1 million babies born every year in South Africa. 900,000 of them are born in the public healthcare system. So you can't do without it. But 100,000 are born in the private healthcare system. So the two healthcare systems can work together. And we shouldn't find them at war with each other, which is what is presently happening at the moment, which is unfair.
All right, so how's this going to be funded, this NHI? That seems to be a question that keeps coming up. Are contributions going to be enough?
I have persistently said the person who must answer that question is the Minister of Finance, because Peter, departments come up with programs. As to how the programs are financed is the duty of the Department of Finance, not us. If the Department of Welfare say there must be a child support grant, they don't decide how it gets funded. It's the Department of Treasury, it's the Treasury that says this is feasible or not. We are coming up with this system of universal health care, which many parts of the world are also trying to establish. Many countries. I've just told you I've been to a conference in Mexico where most of the countries were there. They all find innovative ways of financing it, and we believe South Africa can do the same.
All right. If you fix the public health system, as you're planning to, you're concerned about pricing in the private healthcare system. I'm just wondering, is it not free enterprise, supply and demand? If you can afford to pay for it, it's a business after all.
Well, that's where we'll start differing, Peter. I started by saying health is a public good, and the attainment of the highest standard of health is the most important worldwide social goal. And its realization needs many sectors, economic, social, as well as the healthcare sector. Peter, health is not just any other commodity. It's a right enshrined in the Constitution. And if you leave the so-called free market without any regulation, without any control, in any part of the world, you'll never have a healthcare system, because that will lead to uncontrolled commercialism, with the World Organization is identified. I don't think we can do that.
All right, so you're going to regulate?
Of course, yes.
Okay, all right, let's go to table number 7. Is that David Moholoholo?
It's Mokokolo, Peter.
Okay, sorry. All right.
Morning, Honorable Minister. You mentioned, I'll use the word watchdog, that will be employed at the National Department of Health. That will make sure that the non-negotiables are definitely non-negotiables. And you also mentioned that the MEC will have to comply. Now, my question is, the District Health Authority, where does it leave it? Will they still be part of NHI? Will they still be having the powers? And will they be part of the pilot? I'm from Beckton Dickinson and Company, popularly known as BD, a member of Summit and SALDA.
Yes, Peter, indeed. Part of the first 5 years of piloting NHI is to establish very strong district health authorities, because those are going to be having purchasing powers of NHI on behalf of citizens in that district. We are going to pilot it very, seriously to see if districts indeed have got that ability. But that's exactly what is being planned, and that's what's going to happen. Then you can't run NHI without a strong district health authority purchasing and running healthcare in that particular district. At the moment, we do have districts, but they are very weak, and they need to be strengthened, and that is going to be happening over the next 5 years.
Okay, Minister, earlier you talked about tender care system in this country, and I was just wondering, corruption seems to be everywhere across the board. How are you managing that in the healthcare system?
Well, we need to be vigilant, all of us, not only me, all of us, because this country belongs to all of us. If there's corruption that brings down the healthcare system, it will affect all of us. And I deliberately mentioned the word tender care system, because that's what has happened in quite a number of provinces, where basic healthcare has actually been pushed aside. And in the center, we brought tender care, where, at the core of the healthcare system is tenders, and no help. Now, we must define what you actually want in the healthcare system. And the issues of business must follow what is defined for healthcare, not the other way around. You don't define the business you want and establish healthcare. You define the healthcare you want and see where business will play a role.
Okay. All right, we're running out of time, so let's try and get through as many of these as possible. Heidi, table number 3. I can't quite make out your surname. If you could just say it. Heidi, table number 33.
Thanks, Peter. It's Heidi Kruger speaking, and I represent the Board of Healthcare Funders, who is the representative body for medical schemes and their members. Minister, you spoke about uncontrolled commercialism, and in the same breath spoke about regulating prices in the private sector. 3 of the biggest issues facing medical scheme members, I think, are the lack of pricing, the set of minimum benefits, which are hospice-centric, and the fact that there's no mandatory cover in the private sector. I'd like to know what the role of medical schemes is in this and what you intend to do about it.
All right, so we're struggling to hear you,
Yes,
so if you could just ask the point of your question, if you could summarize it all once again. What's your most important issue?
Well, it's alluding to uncontrolled commercialism and regulating prices in the private sector.
Okay.
Three of the issues facing medical schemes and their members in terms of affordability is the fact that there's no mandatory cover, as the Minister was talking about just now, the fact that there's no tariff in the private sector for suppliers to adhere to, and the fact that the prescribed minimum benefits, which is the set of minimum benefits which medical schemes have to offer, are hospice-centric and curative in focus.
All right, so I think this is something that we might have dealt with earlier on, but she's concerned about pricing in the private sector, that basically there's very little control, and I wonder whether you are going to find a way to intervene. Again, you know, you have a situation where you choose private care. If you're not going to a public hospital, are you able to intervene on behalf of those people, you know, in terms of getting set tariffs and that kind of thing?
Well, I think I need to. At the moment, it's very difficult. And believe you, Peter, people phone me. Not poor people. Poor people have already known they can't go there. They go to the public hospital and queue there. I'm talking about the middle class, who are shocked sometimes by these prices. Phone me at the gate of a hospital and say, Minister, please help. I'm here, I've got a very sick child, they want 15,000 rand now, here and now. I've had such phone calls. And I'm saying we need a way in which we can intervene, including the fact that there are no more tariffs because of problems that happened with the Competition Commission. I am speaking to them. Because, Peter, I'm not the Minister of Public Health. I'm a Minister of Health, the whole healthcare system in the whole country. So I need to have something to say about it. I know of no Minister of Health in any part of this world who's not interested in healthcare pricing and who doesn't wish that healthcare should be as affordable as possible to the citizens of that particular country. I know no minister who can not do that, and I'm doing that, and it's not abnormal. It has to be done, otherwise the effectiveness of the healthcare system will never be improved.
All right, Minister, we've run out of time, so perhaps in 30 seconds, given what you've heard today, some of the questions that have been put through, what are your final thoughts that you'd like to leave our viewers with at home in terms of healthcare? Is it going to be available, affordable, and when?
My feelings are that it is doable, Peter. If you look at the 10-point program, you look at our outcomes, everybody has got a role to play there. As a South African, it won't be affordable if people sit on this side and point fingers at government, or we as government point fingers at them, or we decide to find public healthcare system and private healthcare system as enemies of each other. Then we won't achieve anything. But the plans here on the table are doable. It just depends on what South Africans want. Thank you.
Thank you very much indeed, Minister Aaron Motsoaledi.